Welcome to our channel where we dive deep into the world of sports injuries and recovery. Before we kick off today's topic on Achilles tendon injuries, make sure to hit that like button, subscribe and share this video to help us grow. Don't forget to click the notification bell so you never miss out on our latest content. Check out the link in the description to support our channel through our Amazon affiliate page. A big thank you to our 100+ subscribers for being part of our journey. Now let's get started. This video is about being suddenly sidelined by an Achilles tendon injury. This scenario, which strikes fear into the hearts of athletes and perhaps most people due to the lack of mobility this could present as a result of this particular type of injury. This isn't just a test of physical resilience, but also a challenge that calls for cutting-edge rehabilitation strategies. Understanding Achilles tendon injuries, types and mechanisms. The Achilles tendon, the largest and strongest tendon in the human body, is pivotal for movements such as running, jumping, and quick changes in motion. Injuries to this tendon can broadly be classified into two categories: non-separation injuries, which include tendinitis and tendinosis, and separation injuries, which encompass partial or complete tears. The mechanism of injury typically involves a sudden increase in stress that the tendon can't withstand, often during explosive acceleration or when landing from a jump. The Achilles tendon, the largest and strongest tendon in the human body, is pivotal for movements such as running, jumping, and quick changes in motion. Injuries to this tendon can broadly be classified into two categories: non-separation injuries, which include tendinitis and tendinosis, and separation injuries, which encompass partial or complete tears. The mechanism of injury typically involves a sudden increase in stress that the tendon can't withstand, often during explosive acceleration or when landing from a jump. Understanding the type of injury is crucial in tailoring the rehabilitation process appropriately. Non-separation injuries might require a focus on reducing inflammation and strengthening the tendon, while separation injuries, particularly complete tears, often need surgical intervention followed by intense rehab. The biomechanical complexity of the Achilles tendon means that its healing is influenced by a variety of factors. These include the individual's age, activity level, and the specific nature of the injury. The healing process thus requires a multifaceted approach that not only aims to restore function, but also to prevent future injuries. Innovations in imaging techniques such as MRI and ultrasound are invaluable as they provide detailed visuals of the tendon anatomy and damage, aiding clinicians in developing a precise treatment plan. Once the type and extent of the Achilles injury are established, the rehabilitation process begins. This stage is critical, not just in terms of recovery time, but in the quality of the repair and the risk of re-injury. Modern rehabilitation techniques are increasingly becoming more personalized, incorporating both traditional physical therapy and cutting-edge technologies to create the most effective recovery path for each patient. In the initial phases of rehab, particularly after surgery, the focus is on controlling pain and inflammation. Techniques such as cryotherapy, soft tissue massages, and controlled movements within a pain-free range are common. Progressively, as the patient advances, more dynamic exercises are included to improve strength and flexibility. These might involve resistance training and stretching exercises targeted at not only the Achilles tendon, but also the surrounding muscles and tendons. Technological advances have introduced tools like low-level laser therapy and platelet-rich plasma injections, which accelerate the healing by promoting cell regeneration and increasing blood flow to the injured area. Furthermore, to ensure balanced recovery and mitigate the chances of future injuries, gait analysis and biomechanical assessments are routinely used to adjust the athlete's posture and movement patterns during both walking and running. The final aim of Achilles tendon rehab is not merely to return the athlete to pre-injury levels, but to optimize their entire biomechanical function, thereby enhancing performance and reducing the susceptibility to future injuries. This comprehensive approach requires close collaboration between the patient and healthcare providers, incorporating feedback from ongoing assessments to continuously tailor the rehabilitation process. In conclusion, mastering Achilles tendon rehab demands more than a one-size-fits-all approach. It requires an integration of detailed anatomical knowledge, an understanding of the injury's biomechanics, the intelligent application of advanced therapeutic techniques, and a patient-centric approach that prioritizes individual needs and goals. For health professionals working in sports and orthopedic care arenas, staying abreast of these developments isn't just beneficial, it's essential to guide their patients back to the peak of their physical abilities, ensuring both recovery and resilience. While the journey from injury through recovery is fraught with challenges, one question lingers in the minds of many. What are the long-term effects of an Achilles tendon injury? Research and expert opinions shed light on this vital aspect of patient care. Statistically, the majority of individuals who suffer from an Achilles tendon rupture and undergo proper treatment can expect to regain much of their previous functional level. However, studies indicate that approximately 20 to 30% of patients might experience some form of long-term complications, which can range from mild discomfort during certain activities to more severe chronic conditions, such as recurring pain or even arthritis in adjacent joints. Dr. Emily Norton, a leading orthopedic researcher, highlights that while most patients recover significantly, a subset struggles with ongoing issues that might require additional interventions. Early and accurate diagnosis paired with personalized rehabilitation plans are crucial in minimizing these long-term effects. The data also suggests that adherence to rehabilitation protocols and the use of advanced therapies significantly reduce the risk of permanent debilitation. Yet the physical impact is just one aspect. The psychological resilience required to overcome a severe injury like this cannot be understated. As we push the boundaries of medical science and rehabilitation, understanding the full spectrum of potential outcomes from Achilles injuries helps clinicians better prepare and support their patients through not just recovery, but beyond, towards sustained health and activity.